Hey everyone, this is Dr. April Bice again. Wanted to talk to you just a little bit about prescribing medications, actually applying those skills that we learned about in the prescribing medications video, and kind of talking about how you would work that through writing a prescription for a child and also documenting prescription writing in electronic medical record or an EMR electronic prescription method. All right. So the first thing I wanted to talk to you about is dispensing tools, okay? When your parents give medication, it's very hard for them, if it's a young child, to try to give medication to a toddler or an infant using a spoon. So we want to make sure that we're using the appropriate tools to deliver that medication, such as a syringe. I've had really kind of up in the air luck with whether or not a pharmacist will give my patients the appropriate tool to dispense medication to their children. So I've even gone as far as to write, please dispense with 5 milliliter syringe, or please dispense with 15 cc syringe, etc. So be kind to your caregivers and to your patients, and if you could remind them to ask the pharmacist if it's coming with a syringe, if it's a young child, and if not, to ask the parent or caregiver to ask for one if you don't write for it, because it's very difficult for a parent to try to give a medication. It's also not as accurate using an actual spoon from a household, like a teaspoon or a tablespoon, because often things will spill out of the child's mouth or spill out of the caregiver's hands while they're trying to fight a young child who does not want to take medications during the medication administration process. Now, some of you might already know this if you have a history of working with peds. Others might not. One of those really good little tools that I like to tell my parents when they're administering medications to a young child, usually 3 and under, if you're fighting with them and they don't want to take their medication by mouth, you can pop the medication in the side of the mouth, okay, so in the buccal area or in the cheek, and then blow pretty firmly on the face. That causes a stimulation to swallow. So the child will have a little bit of a morose, and after that, swallow what's in their mouth. Now, you don't want to tell your parents to administer a giant large amount in one little go inside the cheek. If it's 10 cc's, maybe administer 3 or 4. If it's 5 cc's and it's a younger child, maybe administer 2 or 3, and then try that same technique again. It's pretty helpful. All right, so the next thing that I wanted to talk to you about was, let's go over just some actual examples of how to apply utilizing, let's see here, writing a prescription, whether it be electronic or handwritten. So here's an example here. We'll just say that this is a prescription pad, okay? So you'll see the name of the practice at the top. Well, characteristically, you'll have the names of the providers at the top as well. And you always want to make sure you're circling your name, okay, because that's essential, especially as an FNP, because sometimes they will be searching for your collaborative or supervising physician. So you want to make sure that you're circling your name, and sometimes I'll put a little check by who my supervising MD is or collaborating MD is, just to help the pharmacist, follow all the rules and guidelines for the state of North Carolina. Next, always make sure that you have the date of the prescription that you're writing. If it is a controlled substance and you are not delivering it electronically, because that's something we do not do yet, we always handwrite controlled substance prescriptions, then you're going to make sure that that handwritten date is on there. Next, patient name. Full name is essential. Now here I have just a J. Doe, but you want to make sure you're writing out the full name of your patient, okay? And the pharmacist will always look up a patient by their full name, so documenting their first and last name is essential. This one I added in. There's not going to be very many places on a prescription pad that have age and weight. They will have date of birth sometimes, but you always want to put a date of birth or age and also the patient's weight. Okay, that's essential for a pharmacist to know because pharmacists are so smart, as I described in the last video, and they will catch on to things. So if you perhaps made an error in your prescription dosing or your prescription writing, they might be able to look back at that and say, that doesn't look correct. So provide your pharmacist as much information as possible. More is better than less in this circumstance to keep your patient safe, your pharmacist protected, and you protected. So next, let's move on to the SIG. So the SIG essentially means, what are you telling this patient to do or this family to do with this medication? What are the directions for giving this medication? All right, amoxicillin suspension. First is going to be the name of the medication. Now, some people don't write out suspension or liquid or tablets. I always do. And the reason is you don't want tablets or suspension or elixir, there's so many different formulations of a medication to be confused. So again, make it safe for you, safe for your patient, and easy on your pharmacist, and write out what you want to prescribe. Okay? Make sure you're checking spelling of medications if you don't know the name. Never, ever do abbreviations for your medication names. That is an unsafe practice. All right? And many pharmacists will not even take it. So amoxicillin suspension. Give the concentration. That's essential because amoxicillin comes in 400 per 5 mLs, it comes in 250 per 5 mLs, and it comes in tablets, it comes in capsules, it comes in so many preparations. So you want to tell the pharmacist what concentration you want them to give out. All right, so 400 milligrams per 5 mLs, and then you want to tell the patient specifically what they're going to be doing. So give 6 milliliters, PO, and you can, use PO as your indication for your route twice daily for 10 days for right otitis media. So this is just me giving the pharmacist a little heads up of why I'm giving that prescription, okay? I'm giving them the indication. They don't necessarily need to know that, but hey, you know why that helps you? Because what if you were to write here for pain? Your pharmacist would look at that and go, well, why are they giving an antibiotic for pain? Whoops, maybe they were meant to write for something else. So again, protect you, protect your patient, and protect your pharmacist. Give as much information as you possibly can to keep your patient safe. Next, you're going to write how much you want to dispense, okay? So one bottle here of how much. Your dosing for that would be 6 mLs times 2 times 10. So it would be one bottle of 120 milliliters. Okay? And that's basically just the same thing as saying dispense quantity sufficient. You could write also dispense quantity sufficient. All right? Some people will do that. And I usually will write just the milliliters instead because that's more safe to me, in my practice, but it would be acceptable for you to do both. And you always want to write whether or not the patient is going to get a refill. All right? Antibiotics are very untypically refilled unless you are giving them, a 21 to 30-day supply for a serious chronic or acute on chronic sinusitis, etc. But this is also another good clue as if you're writing the correct thing here, because if you write, refill times 4, pharmacist is probably going to know that that was likely an error in your electronic medical prescribing or your handwritten prescription. All right, so an easy way to calculate something like this, and I always prescribe, let's pull that up again. There we go. An easy way to do a calculation on your calculator, okay? When you are trying to figure out how many milliliters with milligrams, you can do this all in one step of your calculator. So I've got the directions here written, and I'm going to do it in my calculator with you, okay? So we've got the child's weight in kilograms, all right, and the child weighs 10.9 kilograms. We're going to multiply that by the max dose in milligrams, okay, that they can have per kilogram daily. So they can have, for otitis media, up to 90 milligram per kilogram per day. All right, so we know that their max dose per day is 981 milligrams. Well, that's not all we want to know, because we want to know how are we going to be dispensing that in milliliters, right? So the next thing you're going to do is divide that by the concentration in milligrams. That gives you 2.45. Followed by that, you're going to multiply by the milliliters in the concentration, which in this case it's 5 milliliters, okay, because you had 400 per 5. All right, that's the max dose per day, 12.26. But you want to dose that twice a day, don't you? So you're going to divide that by 2 times a day, which is divided by 2. And you know that your approximate dose for this child is going to be 6 milliliters twice a day if you wanted to dose them at 90 milligram per kilogram per day. Okay, you're not going to write for 6.13 milliliters. All right, please be nice to your parents. That's why I rounded it off to 6, but that's a little quick way for you to understand that you can do that very quickly in your calculator without really even making any kind of changes as you go mathematically. All right, so let's pull up another example here. All right, so we've got all the same criteria here, but this time, all right, we've got a 14-year-old, John Doe, and he's 54.9 kilograms. And we're going to be doing something a little bit different, okay? When you dose medications, you don't just dose in milliliters, you don't just dose in tabs, you don't just dose in capsules. You also dose in actuations. What's that? It's a puff of an HFA or inhaler or MDI, okay, type of MDI. All right, so you want to make sure that you're understanding all the types of ways that you're going to be writing prescriptions. Here's an example of one RX Sig, ProAir. Okay, ProAir is one brand name for albuterol. Now, some years back, albuterol, the actual generic albuterol, was taken off the market because of some damages apparently, and I'm not joking here, that it was causing to the ozone layer. So now we have brand names that we deal with, like ProAir and Ventolin instead. So you can still write albuterol, but the way it will be prescribed is actually in a brand name like ProAir or Ventolin for your patients. So here, 90 mics per actuation is the way that ProAir HFA comes dosed. And then you want to put here the directions: inhale 4 puffs every 4 hours, PRN for wheezing or cough. Okay, see how that's clearly stated what you want the patients to do. Another thing you might add here is if it's the first time you're giving it, or if it's the mom says, you know what, oh my gosh, I don't know if we have our aero chamber still. Dispense with aero chamber, okay? Kids need to have an aero chamber or a form of an attachment to inhale their medication when it's something like albuterol, QVAR, or any kind of an inhaled medication. They don't need to be taking it straight from the inhaler because they don't know how to follow those kind of directions, really well when they're that young. And you can give an MDA or an MDI HFA to a child who's an infant. And in fact, that's most evidence-based. There's no difference between giving a nebulizer treatment or giving MDI treatments when it comes to albuterol, QVAR, etc. with regard to evidence. You can give it to infancy, like I said. So the other thing I wanted to call your attention to here is, dispense 1 inhaler you would put for your quantity. There's sometimes on a prescription pad something that says DAW. That means dispense as written. So if you want your patient to specifically have ProAir and not Ventolin, then you would sign here under the dispense as written. If you don't care what they have and it's, as long as it's a form of albuterol, okay, or it's something that is equivalent to albuterol and brand name doesn't matter to you, then you want to put your signature here, and you don't have to put anything under the dispense as written, or you can, even write a note. Generic okay for dispense. I sometimes do that when I'm writing my prescriptions as well. There is a note section in most electronic medication prescription dispenses. All right, so that's all I have for you right now with regard to medications and examples. I am excited for this week. Lots of great learning. Let me know if you have any questions.